Dr. Ravi Sandhu. I'm a local GP in Walsall working at Modality Kingfisher Darlaston. I'm the clinical director of that PCN and I lead Walsall modality practices. I've also been in the role of women's clinical lead for Walsall Together. So with women's health in Walsall, what we've been doing is in phase one of our project, we've looked at listening to women across the borough, looking in particular to diverse communities to understand what women feel is important for their health and well-being and what may be those challenges. So with that, we did an International Women's Day conference and invited lots of different groups in. We've also been out into the local communities and done focus groups, essentially, questionnaires, etc., to ask, what is important to women. There is a real challenge around women's health and them being able to access the care that they feel that they might need. What we found the most important things were around their diet, their exercise, their mental health, their physical health, and also the family and peer support groups that they have around them. The challenges that they found is that sometimes they feel that they're not being heard. The language barriers can be an issue, so people from the deaf communities are finding it difficult because there may not be enough signers out there to help, and the way that we communicate with them. There were other issues around patients or community who felt that they may be suffering with domestic abuse or had domestic abuse, but they were not being heard in the way that they felt that they should be heard. There's additional pressures on women which impacts the way that they look after their health and well-being, and those are external factors, things around their family, finances, and the pressures that they feel that they're having to do everything around them, and maybe employment issues. There is a lot of information out there, as women rightly said. However, they're not sure which information to trust, which sources to use, because sometimes it's a bit conflicting. So actually being able to provide clear information and explaining to women that this is where you would go for your health resource or your support would be quite useful. There's different perceived conceptions and ideas of what's normal for a woman's health life cycle sort of thing. So that you go through periods, you go through a period of fertility, you go through the menopause, and then you go through the old age changes with the bladder and the bowel. However, women recognise that these are problems, but don't necessarily know the lingo to go with it or what to expect during the times.